Hi, I'm Dr. Scott Carroll. I'm here today to speak about the dangers of prescribing Adderall or taking Adderall uh, for people who have bipolar disorder. Of course, this is not applicable to people who just have ADHD and do not have bipolar disorder, of course. But this talks about the specific dangers in bipolar disorder. So, what is Adderall? So let's talk for a moment about what exactly Adderall is. So it's essentially a type of amphetamine. And specifically in Adderall, it's a mixture of four different types of amphetamines. The traditional chemical synthesis of amphetamine produce four different types. So that's what essentially this mixture is. And there's a list of the four different types. You don't need to really know them. But there are four common prescriptions that contain amphetamines. There are, of course, some others, but these are the ones that are you find most commonly on the market. So there's regular Adderall, then Adderall extended release or Adderall XR, Dexedrine, which is just dextroamphetamine, and then, of course, Vyvanse. Vyvanse is actually a type of amphetamine that actually has to be converted into amphetamine in the liver. So it only works if you swallow it. It doesn't work if you actually inject it, say with a needle or take it in some other manner. Now, the only difference between the different prescriptions is how long they last. So at the low end, you have Dexedrine, which lasts about 3 hours, and then at the high end, you have Adderall extended release, which lasts about 12, with the other two in the middle. Now, the way amphetamine works, it works by increasing dopamine and norepinephrine in the synaptic cleft. And so the way it does that is causing dopamine and norepinephrine are neurotransmitters which are stored in vesicles inside the presynaptic neuron. But the amphetamine, what it does is it both blocks the reuptake of the removal of the removal of dopamine and norepinephrine from the synaptic cleft, and then it increases the release by the vesicles of the dopamine and norepinephrine. So the end result is a significant increase in dopamine and to a lesser degree norepinephrine in the synaptic cleft where it is active. So now the reason why this is important is because Adderall induces mania, and following the mania, it then triggers depression. So we'll talk about how it does that. So the first thing to know is that how mania works. So the basic theory of mania is that during mania, dopamine and other neurotransmitter levels, other stimulatory neurotransmitter levels like glutamate go extremely high. But dopamine is definitely one of the key ones that goes high in mania. Then what happens is, or then what you need to know is that Adderall also causes dopamine to go high. And for reasons we don't fully understand, when the Adderall triggers the dopamine to go high, that actually will then trigger sort of this feedback mechanism where you get mania, where the body starts producing excessive amounts of excessive amounts of dopamine that it releases into the synaptic cleft, as well as glutamate. And there are some other inhibitory neurotransmitters such as GABA, which go very low, which also can produce the profound anxiety of mania. Now, the natural effect of this elevated dopamine, whether it's from Adderall, other types of amphetamine, or mania, is that it causes the dopamine receptors on the postsynaptic neuron to actually decrease. And so if you think about it, the body's always trying to balance things out. So anytime dopamine goes high, because you're getting too much of a dopamine signal, the body then downregulates the dopamine receptors to decrease that signal. So essentially turn the volume down. So when the dopamine levels come down to normal, the receptors are so low that the signal then goes too low. And so this what's initially a compensatory effect to protect the body or protect the brain from the excessive dopamine by downregulating the receptors, then produces too low of a dopamine signal when the dopamine levels come back down to normal, when either the Adderall wears up or the mania ends. So this low dopamine signal is one of the things that causes the profound depression of bipolar. And so if you think about it, the Adderall itself can do this, especially in excessive dosages, such as when someone is using very high dosages of amphetamines, such as either speed or methamphetamine. Though even just high prescription doses of Adderall can produce more can produce milder versions of this, even in people who don't have bipolar disorder. Of course, though, you get probably the strongest effect in someone who has bipolar disorder, where they go manic, the dopamine goes very high, and then the dopamine receptors downregulate and decrease their number. So when the dopamine levels come back to normal, the dopamine signal is so low that it produces that profound depression of bipolar. Now, here is a very crudely drawn example of a synapse between two neurons. So I apologize, I'm not much of an artist, but this was the best I could do. I'm not handy, and also I'm not handy enough with a computer to do this in Photoshop or something really fancy. So please, bear with me and forgive me for my limited drawing skills here. So what I want you to do is you've got the two neurons. So the one to the upper right is the presynaptic neuron, and the one to the lower left is the postsynaptic. And so what you can see, and the little black triangles is the dopamine. That's the neurotransmitter that's in the middle. And then on the receptor on the postsynaptic neuron, you see the receptors where those little triangles can fit in, and you can see an example of binding there. Now, what I want you to notice, now this is a normal synapse. So what you see is you've got plenty of receptors. You've got a modest amount of dopamine free in the cleft. But then you have a larger amount of dopamine still stored in these vesicles. See here, which you can see with the red arrow, and there's another one here. All right. Now let's take a look at what happens when you have Adderall. So when you have Adderall, what then happens is you can see that suddenly all these vesicles release all this dopamine into the cleft. So you see a much higher rate of dopamine floating around in this synaptic cleft between the two neurons. And then you can see that what happens is the body, because you've got so much binding of these receptors, the body then decreases these receptors. So before you saw that we had something like four receptors I drew in. Now you can see I've just drawn in 2 to symbolize the decreased number of receptors. Now here what happens is you see is once the dopamine level comes back, or the dopamine release comes back to normal, you see you see a return of most of the dopamine to those vesicles, those little bubbles inside the presynaptic neuron on the upper right. And you see a more normal amount of dopamine in the synaptic cleft, but then with the decreased number of receptors, you're not getting much of a signal. In fact, you can see there's no binding taking place at all. Now that's not literally true, like there's zero binding, but the binding is much less, and you have much less activation. So just keep this in mind of basically how this process works. Now, one thing to note is that Adderall is very similar to methamphetamine. So I have to remember that methamphetamine, really is almost like a model for mania for people who don't have bipolar disorder, because the methamphetamine causes, especially when taking in the very high dosages that people who abuse methamphetamine typically use, it causes their dopamine to go extremely high, just like in mania. And similarly, just like in mania, the meth causes you to not sleep, be grandiose, be hyperactive. It has a few additional effects you don't see in mania, like some of the tweaking and motor effects, because the mania seems to be limited to the dopamine in the frontal lobes, and doesn't seem to involve the dopamine that's in the movement circuits in other parts of the brain, like the methamphetamine does. But other than that, it's a pretty similar process. Now, of course, when the methamphetamine wears off, the dopamine goes low, and people get very depressed. In fact, I can personally attest to this, having worked, hundreds and hundreds of shifts in emergency rooms with people coming in high on meth. They're psychotic, and then you have to sedate them and treat them. But once the methamphetamine wears off, they turn around, that you can't get them out of bed, they sleep constantly, they feel horribly depressed and suicidal. So then you have to keep them in your ER or admit them to the psychiatric unit until the suicidal thoughts clear, which can take a bit. Though some people, I'm sure, lie about that, and so they can say they're not suicidal, so they can get out the door, so they can go get another fix and not have to experience the full pressures or the full or fully experience the depression of it. Now, one thing I really want to point out that Adderall and methamphetamine are both amphetamines. They work exactly the same way. Now, the main difference, however, between the two is that the methamphetamine lasts much longer than the Adderall, of course. Because methamphetamine has a methyl group attached to the amphetamine, and that methyl group, the body has a really hard time breaking it down, or breaks it down very slowly. And so that's why methamphetamine typically lasts 2 or 3 days, maybe even longer, depending on the dose, whereas regular Adderall typically lasts about 6 to 8 hours. And so it's, when taken in the morning, it's out of your system well before the end of the day. Now, like I said, the other thing too is part of the reason why the very different effects of methamphetamine and Adderall also has a lot to do with the dose. So it's with the time that they work and then the dose. So when people use methamphetamine, illicitly, they typically take hundreds to thousands of milligrams in a single day, versus a more typical dose for Adderall, which is around 10 to 40 milligrams for an adult. So a massive differences, in doses. So now my next point I want to make is that Adderall, or I should say, ADHD is overdiagnosed in bipolar disorder. And so, because a lot of people will tell you who are on Adderall and who have bipolar disorder will tell you that Adderall is not for their bipolar disorder, it's actually for their ADHD. Now, the problem with that, however, is that ADHD symptoms are completely normal during mania. So when you're manic and your dopamine's high, people are often very hyper, they're impulsive, they can't focus because their mind's going rapid, going too fast, it's jumping around, and so they jump from task to task to task, which is pretty typical, and people, think that's, ADHD, except that that's actually not the case. In fact, one of the things about that is when you have a mild manic episode or a hypomanic episode, it can really look just like ADHD. So the big clue that something is not that you don't have ADHD, that you actually just have bipolar and you're just manic, is that your ADHD symptoms come and go. Because in real ADHD, the ADHD is there every single day and it does not change. So people who just have ADHD, they're hyper and impulsive, but it's the same every day. It doesn't come and go. Whereas in bipolar disorder, you're kind of normal for a while, and then, you're hyper and impulsive and unfocused for a few days, while you're not sleeping that much, and then it wears off, you crash, and you're sleeping excessively with very low energy and being very sluggish for a few days, and then you're back to normal. So that kind of ADHD that comes and goes is not real ADHD. And so so if that's the case for you, you just don't have ADHD. You really just have episodes of mild mania that you're mistaking for ADHD. And a lot of people forget this point, that how similar they look, and confuse the two. Now here's the confusing part. Another confusing part is that, but people will then tell you, but the ADHD works so well for my hyperactivity and impulsivity. And that's absolutely true. I'm not disagreeing with you. The problem is that, Adderall, and this is true of all stimulants, is that they work for hyperactivity and impulsivity regardless of cause. You could be delirious. You could have a head injury. You could have, you could have just had a seizure, which is causing it. And the Adderall would work just as well. You can be sleep deprived, which, especially in children, when they get sleep deprived, they get more hyper and impulsive. And so the point being is that the Adderall calms all forms of hyperactivity and impulsivity regardless of cause. So it doesn't. So the fact that you respond to Adderall doesn't mean anything about your diagnosis. And in the key case of Adderall and bipolar disorder is that while it calms that ADHD symptoms during the day, what happens when the Adderall wears off? The mania gets worse. And so, yeah, you're calmer during the day, you're focused a little bit better during the day, but then that night you can't sleep and you're really manic. And if you keep doing it consistently, the mania just gets worse and worse and worse. And the other problem too is that Adderall can permanently worsen bipolar disorder. There's a lot of evidence that it can do that, and we'll talk about this in more depth in some later slides. And another point too is that Adderall can also cause you to hallucinate with bipolar disorder. In fact, we've long known that some people just hallucinate on Adderall. They can't tolerate it at even sort of typical dosages used for ADHD, and also, bipolar disorder makes you very prone to hallucinations, and a lot of people, when they get really manic or really depressed, do hallucinate. And so the Adderall, in addition to permanently worsening it, it can actually make you have psychotic symptoms when you use it. And what's more is when bipolar worsens, so we typically go from mild bipolar or like a cyclothymia to a bipolar type 2 to full bipolar, and then type 1 bipolar disorder with psychotic features, which is those hallucinations and paranoia. And so, that can be, and once you have hallucinations and paranoia with your bipolar disorder, that's a nasty, it's treatable, but it's not fun, I assure you. And it takes a lot more meds to manage that. So, one of the things to stress is that you really don't have to use Adderall for your bipolar disorder. Another question I get is that some people will say that they take their Adderall for their bipolar depression, not the ADHD. Okay, now I don't hear this one quite as much, but I still hear it from patients from time to time. And the thing I would really stress is that there are better treatments for bipolar depression than Adderall, I assure you. A lot of people, and unfortunately, a lot of the patients who tell me that, I take the Adderall for my bipolar depression, and I ask them, like, have you ever tried lithium? Have you ever tried Lamictal, which is also known as lamotrigine? And they're like, no, what is that? And I'm like, really? No one's ever told you about this? So lithium and lamotrigine have been rigorously tested in bipolar disorder, and they have the highest standard, the highest certification for treating every phase of bipolar disorder: the mania, the hypomania, the depression, mixed states, all of it. They're really, two of the very best drugs for bipolar disorder. And I'm shocked when I hear so many patients with bipolar disorder who are on all kinds of combinations that have never even had a discussion about lithium or lamotrigine with their psychiatrist. So, and the other thing I would point out too is that lithium and lamotrigine, they work differently for the bipolar disorder. So when you put them together, they actually don't just add, they multiply. So they're really strong synergistic interactions for depression. Both for depression and mania. So, I use that combination of lithium and lamotrigine, so extensively in my patients with really good benefits. Another option for bipolar depression is light therapy. So, light therapy is where you use a full spectrum lamp to trick the body or trick the brain into thinking, it's not winter. A lot of bipolar depression has a seasonal component where you're more depressed in the fall and winter. And so during that time of the year, when the days are short, at least if you live in the northern hemisphere, it's the opposite and you live in the southern hemisphere. But the days are getting short, it's getting cold, and then, that full spectrum lamp can really work wonders on treating that bipolar depression. In fact, and it can be titrated just, having 1 cup of coffee, 2 cups of coffee, or 3 cups of coffee in the morning to get yourself going. The only thing with light therapy and full spectrum lamps is you have to get a 10,000 lux lux lamp to have solid effects. And if you want to know more about this, you can actually go to my website at scottcarrollmd.com and look up. There's an article that I wrote a couple years ago about using, treating seasonal depression. And I have a long discussion of using light therapy for this effect, and so you can learn more about it there. Now, if all else fails, if you've got lithium, lamotrigine, light therapy going, and that's still not enough, what I would actually recommend for you that's safer is having your psychiatrist give you Wellbutrin, also known as bupropion. It's a antidepressant that focuses on norepinephrine, no serotonin, and just taking it for a few days, just until you kind of kick yourself out of that episode. Not taking it permanently. So very short course of Wellbutrin just to sort of get yourself out of that depressive phase, is a lot safer than taking Adderall every day. Because the problem with the Adderall, it doesn't just knock you out of the depression, it'll shoot you up into a manic. And so then it just perpetuates the cycle without actually improving anything. Now, there's another thing you have to be aware of. Let's get back to that early question I talked about, where I talked about Adderall may worsen bipolar disorder. And so I'm a child psychiatrist, though I treat adults too, but I've treated children my entire career. And what I can tell you is that a lot of what we know about Adderall comes from actually working in children. So because children, ADHD is extremely common in children. Adderall is a first line agent, maybe second line, depending on who you talk to, for treating ADHD in children. And given that bipolar disorder typically doesn't start till puberty. Can start, we think now about 12% of cases start prior to puberty. But most people, who develop bipolar disorder, it comes with puberty. So what happens is we have children with ADHD who get put on Adderall, and maybe they have a family history of bipolar disorder or something like that, and then they actually get manic on the Adderall. Now the problem with that is, what we know is that a lot of these children, even after you treat that initial mania, we'll watch them. Maybe we won't use any mood stabilizers or antipsychotics to see what happens. But I can't tell you, I'd probably say something like 70 or 80% of the time I run across this, the child goes on to have permanent bipolar disorder. And so, while we hope we didn't cause it, maybe they were going to get it, on their own anyway. Hard to say. But it very clearly, the incident and the onset is clearly due to the Adderall. And so that's something to think. And I also, of course, we see cases where, children and teenagers are, misdiagnosed with ADHD who actually have bipolar disorder. They get put on Adderall, and I can tell you that is a mess to deal with. And I've seen some people go from very mild bipolar, teenagers with very mild bipolar disorder that was, subtle, so it was missed, and it goes to, it goes to the full Monty. It goes, all the way to, type 1 with psychotic features, and even catatonic symptoms. And I could tell you case after case after case, where I've seen this. And some of those cases are just incredibly difficult to treat because somebody missed the diagnosis and then left them on Adderall for a few years. And then, we're just, we've got our work cut out for us trying to deal with it. And what's more is, it's not just my experience. The research also shows this, that when people with bipolar disorder and they get Adderall by itself, with nothing else, it clearly causes mania, and then very strong evidence that it'll worsen the bipolar disorder. This is consistent with research about antidepressants doing similar things as well. However, now on the flip side, there is no research that has been done on if you mix the Adderall with a mood stabilizer or an antipsychotic. That research has not been done. So we really, the point being is that we just don't know if the mood stabilizers actually, really work. Because even if you may not be having mania, the question is still there: is the bipolar disorder worsening? And especially if you're young and you worsen bipolar disorder, that means it's going to be worse for life, because we have no cure. Maybe we can hold the line, we can keep it from worsening, we cannot make it better. We can stabilize it, we can manage it, but we can't really improve it at any significant degree. Yet, despite these risks, some psychiatrists still prescribe Adderall in bipolar disorder, which kind of floors me. And of course, I've raised my concerns, and I've taught all my students about these risks, and as far as I know, knock on wood, none of them do that. But I still run across some psychiatrists in the community who will still do this. And so, just because your psychiatrist is willing to do this doesn't make it a good idea. And so if your psychiatrist wants to put you on Adderall, you really need to have a long discussion with them about, is it really safe, and is it really absolutely necessary? And my point is more that, since we don't know, we really should wait on doing this until the research is done that proves it to be safe to do so. maybe I'm wrong. There are reasons why we have to do research, just because not every theory pans out. And so, but until that research is done, I'd say, there is certainly evidence of risk, and that we should avoid doing something that is probably risky until we have pretty clear evidence that it's safe to do so. Um, Now, let's take the counterpoint. Let's say Adderall, doesn't make, doesn't worsen bipolar disorder. So let's say the research does get done. There's still problems with using Adderall in bipolar disorder, even if it doesn't permanently worsen, the bipolar disorder. So let me explain this. So, as I said, there's still risk, because part of the point is, because Adderall clearly can induce mania. When you try to balance the Adderall with, say, mood stabilizers or antipsychotic, it's really hard to do. And I can tell you that it's almost like standing on the brake and the gas at the same time and trying to ease back slightly on each one to somehow move the car forward. And so it's really difficult to strike that balance between the two. And sometimes the balance, changes from different times of the year. Pardon me. And so, so I can tell you it's particularly challenging to do, even when it's not dangerous, even if it were not dangerous. And the other problem is so, and even when if you are able to achieve a balance between Adderall and your other medications, you end up having to use much higher dosages of the other medications. And so I would really stress, that, even if you can pull it off, it doesn't make it a good idea. Because when you use higher dosages of your other your other medications, you're talking about increased side effects, increased risks. And that could be a whole nother lecture in and of itself right there about all these increased risks. We know that, the dose range on lithium is very narrow, and you get a little high and you get bad toxic effects. And then also higher doses of lithium increases your risk of, renal failure. Lamotrigine, not a lot of risk, but getting up on it, while you're titrating up on the dose, very risky, causes very severe life-threatening rashes, known as Stevens-Johnson syndrome, or toxic epidermal necrolysis. I mean, that's a mouthful. TENS is what is the short name for it. But necro as in dead, and lysis meaning to loosen or lose. So it literally, it's a rash where your skin falls off. So, and these are just some of the other, with the issues. And antipsychotics, you have, horrible weight gain issues oftentimes. So, you could just go on and on about all these increased risks and side effects from just these higher dosages. So again, I would make the point, it's much safer to skip the Adderall and just use lower dosages, of your mood stabilizer and antipsychotics. I mean, who likes side effects? I mean, that's one of the great challenges. We have plenty. If there were no side effects to our medications, it'd be easy doing psychiatry. One of the great challenges of psychiatry, while we have medications that work, they can be, the medications are fairly toxic, and they do have lots of side effects, lots of risks, that we're always trying to balance or minimize whenever we're using them. And so, what I would tell you is that, skip the Adderall, and then you should be able to get by with lower dosages of your other medications with less side effects. And then using, some of the strategies we discussed before, such as making, lithium and lamictal together, light therapy, and if absolutely necessary, a very short course of an antidepressant just to pop you out of that, depressive phase, but not to leave it in place. Just, a couple days if absolutely necessary to pop you out. Again, this is sort of a brief overview of a fairly complex, question and topic. But hopefully I've shared some things that make you think a little bit more deeply, about this. And if you're on Adderall, if you have bipolar disorder and you're on Adderall with your other meds, and you're just not stable, it could be the Adderall. And you should talk to your psychiatrist about whether or not a lower dose is more appropriate, or even getting off of the Adderall would be appropriate to you. Obviously, every person's situation is unique. but I presented some general principles here that should help guide you in making the right choice for yourself. All right. And again, you can visit my website at scottcarrollmd.com. I have a there is a I have an article there, and there'll be a link below uh, to that article on my website where I actually discuss this in a little bit more detail. That might be a little bit easier to understand for you. Uh, and feel free to look there. I also have a nice article on lithium, how effective it is as a mood stabilizer. I also have articles on using light therapy for seasonal depression. So various things that can help you on your journey to successfully managing your bipolar and living the fullest life possible. Thank you again.